lift these mandates immediately. Science is not on their side.
So we got Larry Brock here at the Pure Polyab event today, and the big thing on a lot of people's minds, and we saw the response today, was that healthcare workers that are still out of work because of these vaccine mandates.
Yes.
What do you see as the future road to get past that and some of these healthcare workers go back to work? Do you have any thoughts on that?
It's going to take a strong federal leader like Pierre Poilievre and the Conservative government to work with the provincial premiers and the territorial premiers who are allowing their local hospitals to impose these ridiculous mandates and preventing very good qualified healthcare workers from getting back into the system.
Is there any number right now about how many workers remain out of work, healthcare workers in Canada?
I don't know the number, but I personally in Brantford, I hear from a lot of healthcare professionals who have chosen to decide what goes into their own body and have been prejudiced by our local hospital and other hospitals adjacent to Brantford. Okay, I think it's a real problem. They come to me to say, how can the federal government deal with this? And I basically say to them, unfortunately, the Liberal government has made it abundantly clear that it's a provincial issue. It is up to the province to decide what they do with their local hospitals.
So avoidance, basically.
Exactly. That's
So
all it
what
is.
can citizens do? Is there anything people can do?
Is basically write to their MPPs, write to the premiers across this country and say, we recognize that we have got a healthcare crisis. We've got qualified Canadian professionals who want to care for patients. We need to get back into the hospital, lift these mandates immediately. Science is not on their side. If someone's in a crisis and needs hospital care, the last thing that they're worried about is whether or not that healthcare professional is masked or not. They want treatment. We all recognize that there's a problem with healthcare. We all recognize that it needs to be fixed. We recognize that comes with more qualified doctors, nurses, technicians. The solution is staring right in our face. So it's a common sense solution. Okay? Just get it done.
Thank you for what you do.
Okay? Thank you, my friend.